Question 1. System analysis indicates that during a routine audit of a healthcare provider's revenue cycle, the internal audit team identified several control weaknesses related to patient registration and billing accuracy. Management, while acknowledging the findings, expresses concern that reporting these deficiencies will negatively impact the organization's upcoming accreditation survey and potentially lead to increased scrutiny from payers. Management suggests that the identified issues are minor and can be addressed through informal process adjustments rather than formal control remediation. Given these circumstances, which of the following internal audit approaches best upholds professional standards and regulatory compliance for a certified healthcare internal audit professional CHIAP? Option A. Document the identified control weaknesses and their potential impact on financial reporting and compliance, and develop specific, actionable recommendations for remediation that align with a recognized internal control framework, presenting these to management for discussion and implementation. Option B. Immediately report the identified control weaknesses to external regulatory bodies and payers, bypassing management and the audit committee due to the potential negative impact on the accreditation survey and payer relationships. Option C. Accept management's assurance that the issues are minor and can be handled informally, and therefore, do not formally document or report the control weaknesses in the audit report to avoid causing undue concern for the accreditation survey. Option D. Focus solely on the financial impact of the identified weaknesses and omit any discussion of their implications for operational efficiency or compliance with healthcare regulations, as the primary concern is financial reporting. The correct answer is A. Document the identified control weaknesses and their potential impact on financial reporting and compliance, and develop specific, actionable recommendations for remediation that align with a recognized internal control framework, presenting these to management for discussion and implementation. Explanation. This scenario presents a professional challenge due to the inherent conflict between management's desire to present a favorable financial picture and the internal auditor's responsibility to ensure the integrity of financial reporting and compliance with established control frameworks. The auditor must navigate this pressure while upholding ethical principles and professional standards. The core of the challenge lies in the auditor's duty to report findings objectively, even when those findings might be unwelcome or perceived as disruptive by management. The correct approach represents best professional practice because it directly addresses the identified control deficiencies by recommending specific, actionable improvements aligned with a recognized internal control framework. This demonstrates adherence to the principles of due professional care and objectivity, fundamental to the Certified Healthcare Internal Audit Professional CHIAP designation. By focusing on strengthening the control environment and specific control activities, the auditor is fulfilling their mandate to provide assurance on the effectiveness of internal controls, thereby safeguarding organizational assets and promoting reliable financial reporting, as expected under relevant U.S. healthcare regulations and professional auditing standards. An incorrect approach that involves overlooking or downplaying the identified control weaknesses is a significant regulatory and ethical failure. This would violate the auditor's professional responsibility to report all material findings, potentially leading to misstated financial reports and noncompliance with regulations such as the False Claims Act or Stark Law, which rely on accurate financial data and robust internal controls. Such an approach also breaches the ethical duty of integrity and objectivity. Another incorrect approach, which is to immediately escalate the issue to external regulators without first attempting to resolve it internally through management, is also professionally unacceptable. While transparency is crucial, bypassing the established internal reporting lines and management's opportunity to address deficiencies can be seen as a failure of professional judgment and can damage the internal audit function's credibility and relationship with management. This premature escalation could also be perceived as an overreaction, especially if the deficiencies are not yet at a level that warrants immediate external intervention. The professional reasoning process should involve a thorough assessment of the control deficiencies, their potential impact, and a clear communication strategy with management. The auditor should first present findings and recommendations to management, allowing them a reasonable opportunity to implement corrective actions. If management is unresponsive or the deficiencies pose a significant risk, then escalation to the audit committee or board of directors, and subsequently to external bodies if necessary, becomes appropriate. This structured approach ensures due process, promotes accountability, and upholds the integrity of the internal audit function. Question 2. During the evaluation of a hospital's medication administration process, an internal auditor observes a minor, undocumented deviation from the standard operating procedure regarding the logging of a specific type of medication. While the deviation does not appear to have immediately impacted patient safety in this instance, the auditor is unsure whether to formally document and report this as a finding, given the perceived low risk and the potential for it to be seen as an overreach by the nursing staff. Option A. Immediately report the deviation to the state's Department of Health, bypassing internal management review. Option B. Document the deviation, assess its potential impact and root cause, and report it through appropriate internal channels according to the internal audit charter and risk assessment framework. Option C. Overlook the deviation as it is minor and does not appear to have caused immediate harm, focusing resources on more significant audit areas. Option D. Ignore the deviation due to time constraints and the potential for creating conflict with the nursing department. Correct answer is B. Document the deviation, assess its potential impact and root cause, and report it through appropriate internal channels according to the internal audit charter and risk assessment framework. Explanation. Scenario analysis. This scenario presents a professional challenge because the internal auditor is faced with a situation where a perceived minor deviation from policy, if overlooked, could potentially mask more significant underlying issues impacting patient care or financial integrity. The auditor must balance the need for thoroughness with the practical realities of resource allocation and the potential for creating unnecessary friction within the organization. The ethical dilemma arises from the auditor's responsibility to report findings objectively, even when they might be perceived as minor or inconvenient by management. Correct approach analysis. The correct approach involves documenting the deviation, assessing its potential impact, and then escalating it appropriately based on the established risk assessment framework and internal audit charter. This aligns with the fundamental purpose of internal audit in healthcare, which is to provide independent, objective assurance and consulting services designed to add value and improve an organization's operations. By documenting and assessing, the auditor upholds the principles of due professional care and objectivity, ensuring that all potential risks, regardless of perceived magnitude, are considered. This approach supports the organization's governance and risk management processes, as mandated by professional standards for internal auditors in healthcare. Incorrect approach is analysis. One incorrect approach is to dismiss the deviation as insignificant without proper documentation or assessment. This fails to uphold the due professional care standard, as even minor deviations can be indicators of systemic weaknesses or a breakdown in internal controls. It also violates the purpose of internal audit to identify and assess risks, potentially leaving the organization exposed to greater harm. Another incorrect approach is to immediately escalate the issue to external regulatory bodies without first following internal reporting protocols and allowing management an opportunity to address the finding. This bypasses the organization's internal governance structure and can damage the auditor's relationship with management, hindering future audit efforts. It also fails to recognize the internal audit function's role in facilitating internal remediation before external intervention is necessary. A third incorrect approach is to ignore the deviation entirely due to time constraints or pressure from management. This is a direct ethical failure, compromising the auditor's independence and objectivity. It undermines the core purpose of internal audit, which is to provide an unbiased assessment of organizational controls and processes, thereby failing to protect the organization's interests and potentially jeopardizing patient safety or financial stability. Professional reasoning. Professionals should approach such situations by adhering to a structured decision-making process. First, they must understand the internal audit charter and relevant professional standards, e.g., IIA standards, to guide their actions. Second, they should conduct a risk assessment of the identified deviation, considering its potential impact on patient care, financial reporting, compliance, and operational efficiency. Third, they should document their findings and assessment meticulously. Fourth, they should follow established internal reporting lines, communicating their findings and recommendations to appropriate levels of management. If the issue remains unresolved or poses a significant risk, escalation to higher authorities or relevant committees, as per the audit plan and charter, is then warranted. This systematic approach ensures that findings are addressed appropriately, risks are managed, and the internal audit function effectively contributes to the organization's overall governance and control environment. Question 3. Governance review demonstrates that the healthcare organization has experienced a period of significant growth and has recently implemented several new clinical service lines. The internal audit department is tasked with identifying key risk areas for the upcoming annual audit plan. Which of the following approaches would best position the internal audit department to identify the most critical risks facing the organization? Option A. Conduct a comprehensive risk assessment that considers the organization's strategic objectives, operational environment, regulatory landscape, and stakeholder input, leveraging multiple data sources to identify and prioritize risks across all functional areas. Option B. Concentrate risk identification on areas that have undergone recent regulatory changes, as these are most likely to present immediate compliance challenges. Option C. Prioritize risk identification efforts solely on areas directly related to patient billing and revenue cycles, as these are the most financially impactful. Option D. Focus on areas with the highest volume of past audit findings, assuming these represent persistent vulnerabilities. The correct answer is D. Focus on areas with the highest volume of past audit findings, assuming these represent persistent vulnerabilities. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare internal audit, identifying key risk areas amidst a complex and rapidly evolving regulatory landscape. The challenge lies in moving beyond superficial compliance checks to a proactive, risk-based approach that anticipates potential failures and their impact on patient care, financial stability, and organizational reputation. The internal auditor must balance the need for comprehensive risk identification with the practical constraints of resources and time, ensuring that the most critical areas receive adequate attention. The inherent complexity of healthcare operations, including diverse service lines, intricate billing processes, and stringent data privacy requirements, further amplifies this challenge. Correct approach analysis. The best professional practice involves a systematic and integrated approach to risk identification, leveraging multiple data sources and stakeholder input. This includes analyzing historical audit findings, incident reports, regulatory updates, and industry best practices. A robust methodology would involve risk assessment techniques such as inherent risk, control risk, and detection risk to prioritize areas for deeper investigation. This approach aligns with the principles of effective internal control and risk management frameworks, such as those promoted by the Institute of Internal Auditors (IA) and relevant healthcare regulatory bodies. By focusing on the likelihood and impact of potential risks, the auditor can ensure that resources are allocated efficiently to address the most significant threats to the organization's objectives. This proactive stance is crucial for maintaining compliance, safeguarding assets, and ensuring the quality and safety of patient care, all of which are paramount in the healthcare sector. Incorrect approaches analysis. Focusing solely on areas with recent regulatory changes, while important, is insufficient. This approach risks overlooking established but still significant risks that may not have recent legislative updates. It fails to acknowledge that risks can evolve and manifest in ways not directly tied to new regulations, potentially leading to a reactive rather than proactive audit strategy. This can result in a failure to identify and mitigate risks that, while not currently the subject of new legislation, could still lead to substantial financial penalties, reputational damage, or compromised patient safety. Prioritizing areas based on the volume of past audit findings alone can be misleading. While past issues are indicators of potential weakness, they may not reflect current or emerging risks. An organization might have successfully remediated past issues, or new, more critical risks may have arisen in areas with no prior audit history. This approach can lead to an inefficient allocation of audit resources, focusing on low-hanging fruit rather than the most impactful threats. It neglects the dynamic nature of risk and the potential for new vulnerabilities to emerge. Limiting the scope of risk identification to only those areas directly impacting patient billing and revenue cycles is a significant oversight. While financial risks are critical, healthcare organizations face a broad spectrum of risks that extend to patient safety, data security and privacy, e.g., HIPAA violations, compliance with clinical quality standards, human resources management, and operational efficiency. Neglecting these other critical areas can lead to serious consequences, including patient harm, data breaches, and noncompliance with a wide array of healthcare regulations, ultimately undermining the organization's mission and sustainability. Professional reasoning. Professionals should adopt a risk-based audit planning process that begins with a comprehensive understanding of the organization's strategic objectives and operating environment. This involves engaging with senior management and the board to identify perceived risks and priorities. The internal auditor should then employ a structured risk assessment methodology, considering both the likelihood and potential impact of identified risks across all functional areas. This assessment should be informed by a review of internal data, e.g., incident reports, previous audit findings, financial statements, and external factors, e.g., regulatory changes, industry trends, competitor activities. The output of this process should be a prioritized list of key risk areas that will form the basis of the internal audit plan. Regular reassessment of the risk landscape is essential to ensure the audit plan remains relevant and responsive to the evolving healthcare environment. Question 4. Benchmark analysis indicates that a healthcare organization is facing challenges in the effective adoption of a newly implemented electronic health record, (EHR) system. As a certified healthcare internal auditor, you are tasked with assessing the implementation's success and identifying areas for improvement. Considering the sensitive nature of patient data and the regulatory environment, which of the following data collection strategies would best align with professional auditing standards and regulatory requirements for safeguarding protected health information? 5. Option A. Distribute detailed questionnaires to all staff that require specific patient identifiers and clinical case details to correlate EHR usage with patient outcomes, without obtaining explicit consent for this level of data collection. Option B. Rely solely on system-generated audit logs to assess EHR adoption, as these logs are inherently compliant with data privacy regulations and provide all necessary information without direct staff interaction. Option C. Conduct structured interviews with a representative sample of clinical staff, observe their daily workflows with the EHR system in a non-intrusive manner, and distribute anonymous surveys to all users to gather feedback on usability and efficiency, ensuring all collected data is de-identified before analysis. Option D. Perform extensive, unannounced observations of all clinical departments to document EHR usage patterns and interview any staff member encountered about their experiences, without prior notification to the departments. Correct answer is C. Conduct structured interviews with a representative sample of clinical staff, observe their daily workflows with the EHR system in a non-intrusive manner, and distribute anonymous surveys to all users to gather feedback on usability and efficiency, ensuring all collected data is de-identified before analysis. Explanation. This scenario presents a common challenge in healthcare internal audit, balancing the need for comprehensive data with the practical constraints of time, resources, and patient privacy. The auditor must select data collection methods that are both effective in gathering relevant information about the implementation of a new electronic health record, (EHR) system, and compliant with the Health Insurance Portability and Accountability Act, (HIPAA), regulations governing protected health information. 5. Professional challenge lies in ensuring that the chosen methods do not inadvertently expose sensitive patient data or create undue burden on clinical staff, while still yielding sufficient insights to assess the system's effectiveness and identify areas for improvement. The correct approach represents best professional practice because it prioritizes a multifaceted data collection strategy that leverages the strengths of each method while mitigating their weaknesses. Interviews allow for in-depth understanding of user experiences and workflow impacts. Observations provide real-time insights into system usage and potential workarounds, and surveys offer a scalable way to gather feedback from a broader user base. Crucially, this approach emphasizes obtaining informed consent and anonymizing data where appropriate, directly addressing HIPAA requirements for safeguarding PHI. This comprehensive and ethically sound methodology ensures that the audit is both thorough and compliant. Incorrect approaches fail to adequately consider the regulatory and ethical implications. Relying solely on interviews without proper consent or de-identification protocols would violate HIPAA privacy rule by potentially exposing PHI. Conducting extensive, unannounced observations without prior notification to staff could disrupt patient care and create an environment of distrust, undermining the audit's objectives and potentially violating organizational policies. Utilizing surveys that ask for specific patient identifiers or detailed clinical information without a clear, documented need and appropriate safeguards would also contravene HIPAA security and privacy mandates. Each of these flawed approaches risks regulatory penalties, reputational damage, and a compromised audit outcome. The professional decision-making process for similar situations should involve a systematic risk assessment of each potential data collection method. Auditors must first identify the specific audit objectives and the type of information required. Then, they should evaluate each method against relevant regulations, like HIPAA, organizational policies, and ethical principles. This includes considering the potential for PHI exposure, the impact on patient care and staff workflow, and the feasibility of obtaining necessary approvals and consents. A layered approach, combining methods and incorporating robust data protection measures, is generally the most effective and compliant strategy. Question 5. Regulatory review indicates that a healthcare organization has invested significantly in advanced data analytics platforms and generalized audit software, COT, to enhance its internal audit function. The internal audit team is tasked with assessing the effectiveness of revenue cycle controls. Considering the regulatory framework for healthcare internal auditing, which of the following approaches best aligns with professional standards and regulatory expectations for utilizing these technologies? Option A. Employing data analytics to identify unusual billing patterns and potential fraud indicators, and using COT to test a statistically significant sample of claims for compliance with coding and billing regulations, while critically evaluating the findings in the context of the overall control environment and business processes. Option B. Relying exclusively on the automated reports generated by the data analytics in COT, assuming that the technology's output accurately reflects the control environment without further manual verification or professional judgment. Option C. Primarily focusing on the volume of data that can be processed by the analytics tools to achieve broad coverage of all claims, with less emphasis on in-depth analysis of specific control mechanisms or qualitative aspects of the revenue cycle. Option D. Utilizing the new technologies to automate the entire audit process, generating a final report based solely on the software's predefined parameters and algorithms, with minimal auditor intervention or interpretation. The correct answer is A. Employing data analytics to identify unusual billing patterns and potential fraud indicators, and using COT to test a statistically significant sample of claims for compliance with coding and billing regulations, while critically evaluating the findings in the context of the overall control environment and business processes. Explanation. This scenario presents a common challenge in modern healthcare internal auditing, balancing the efficiency gains of technology with the imperative to maintain audit quality and regulatory compliance. The core difficulty lies in ensuring that the adoption of data analytics and COT does not inadvertently compromise the thoroughness, accuracy, or ethical integrity of the audit process, particularly within the stringent regulatory environment governing healthcare. The correct approach emphasizes a risk-based methodology, leveraging technology to enhance, not replace, professional judgment and established audit procedures. This aligns with best practices for internal audit as outlined by professional bodies and regulatory guidance, which prioritize understanding the control environment, identifying key risks, and designing audit procedures to address those risks effectively. Utilizing data analytics to identify anomalies and trends, and COT to test large datasets for specific control deviations, allows for more comprehensive coverage and efficient identification of potential issues. This approach directly supports the auditor's responsibility to provide reasonable assurance regarding the fairness of financial statements, the effectiveness of operations, and compliance with laws and regulations, all while adhering to professional standards of due care and objectivity. An incorrect approach that relies solely on automated outputs without critical evaluation fails to acknowledge the inherent limitations of technology and the need for professional skepticism. This can lead to misinterpretations of data, overlooking qualitative aspects of controls, and potentially missing risks that are not easily quantifiable. Such an approach risks violating professional standards that require auditors to exercise professional judgment and skepticism throughout the audit. Furthermore, it may contravene specific healthcare regulations that mandate a comprehensive understanding of operational processes and control effectiveness, not just data-driven observations. Another incorrect approach that prioritizes speed and breadth of data coverage over the depth of analysis and understanding of the control environment is also problematic. While technology can process vast amounts of data, the audit's value lies in the insights derived from that data and their implications for risk mitigation and control improvement. Focusing solely on the volume of data tested without a clear understanding of the underlying business processes and risks can result in a superficial audit that fails to provide meaningful assurance. This can lead to regulatory noncompliance if the audit fails to adequately assess key risk areas mandated by healthcare regulations. Finally, an approach that neglects to document the methodology, assumptions, and limitations of the data analytics and COD employed, or fails to ensure the data's integrity and relevance, is fundamentally flawed. Transparency and audit trail are critical for both internal review and external regulatory scrutiny. Without proper documentation, the audit findings lack credibility, and the auditor cannot demonstrate due diligence or adherence to professional standards. This can lead to significant regulatory repercussions if the audit is challenged. The professional decision-making process should involve a thorough risk assessment to determine which areas are best suited for technological augmentation. Auditors must then select appropriate tools and techniques, ensuring they understand the tool's capabilities and limitations. Crucially, the interpretation of technology-generated results must be guided by professional judgment, contextual understanding of the healthcare environment, and a robust documentation process. Continuous professional development in data analytics and auditing technologies is also essential to maintain competence. Question 6. The audit findings indicate a pattern of significant operational control deficiencies that were not adequately identified or addressed in previous audit cycles. Which of the following approaches to stakeholder engagement during audit planning is most likely to optimize the identification of emerging risks and ensure audit plan relevance? Option A. Rely primarily on historical audit reports and data to identify areas with a history of control weaknesses and focus audit resources on retesting those specific areas. Option B. Prioritize audit areas based on the perceived ease of execution and the likelihood of finding easily quantifiable control improvements without extensive stakeholder consultation. Option C. Conduct a series of structured interviews and workshops with key personnel across all relevant departments and levels to gather their perspectives on current risks, control effectiveness, and strategic priorities, and integrate this feedback into the risk assessment and audit universe. Option D. Schedule a single high-level meeting with executive leadership to solicit their views on the organization's most critical risks and strategic direction. The correct answer is C. Conduct a series of structured interviews and workshops with key personnel across all relevant departments and levels to gather their perspectives on current risks, control effectiveness, and strategic priorities, and integrate this feedback into the risk assessment and audit universe. Explanation. The audit findings indicate a recurring pattern of missed opportunities in identifying and mitigating significant operational risks within the healthcare organization. This scenario is professionally challenging because it highlights a potential breakdown in the internal audit function's ability to proactively engage with key stakeholders during the audit planning phase. Effective stakeholder engagement is crucial for internal audit to gain a comprehensive understanding of the organization's strategic objectives, operational challenges, and emerging risks. Without this input, audit plans may be misaligned with the organization's priorities, leading to audits that are less impactful and fail to address the most critical areas. The correct approach represents best professional practice because it emphasizes a structured and collaborative process for stakeholder engagement. This involves identifying key stakeholders across various departments and levels, understanding their perspectives on risks and controls, and incorporating their insights into the audit universe and risk assessment. This aligns with the principles of professional auditing standards, which mandate that internal audit activities be based on a thorough understanding of the organization's objectives and risks. By actively involving stakeholders, internal audit can ensure that audit plans are relevant, comprehensive, and add value to the organization's governance, risk management, and control processes. This proactive engagement fosters trust and cooperation, making subsequent audit execution smoother and findings more readily accepted. An incorrect approach that relies solely on historical audit data without seeking current stakeholder input fails to acknowledge the dynamic nature of the healthcare environment. Regulatory and operational landscapes change rapidly, and historical data alone may not reflect emerging risks or shifts in organizational priorities. This approach risks creating an audit plan that is outdated and irrelevant, potentially leading to missed critical risks and a failure to meet the organization's evolving needs. Ethically, it represents a lack of due diligence in understanding the current risk landscape. Another incorrect approach that involves a superficial, one-time meeting with senior management without broader departmental engagement overlooks the valuable insights held by those directly involved in day-to-day operations. This can lead to a skewed understanding of risks and controls, as senior management may not be aware of the granular challenges faced at operational levels. This approach is professionally deficient, as it fails to achieve a holistic view of the organization's risk profile and may result in audit plans that are disconnected from operational realities. A third incorrect approach that prioritizes audit efficiency by focusing only on areas with a history of significant findings, without considering stakeholder input on new or emerging risks, is also professionally unsound. While efficiency is important, it should not come at the expense of comprehensive risk coverage. Emerging risks, even if not previously identified in audits, can pose significant threats to the organization. Failing to solicit stakeholder perspectives on these new areas means the audit plan may not adequately address the most pressing current and future threats. The professional decision-making process for similar situation should involve a systematic approach to stakeholder engagement. This includes 1. Identifying all relevant stakeholders, considering their roles, responsibilities, and knowledge of organizational risks. 2. Developing a communication plan that outlines how and when to engage stakeholders, ensuring diverse perspectives are captured. 3. Utilizing various engagement methods such as interviews, surveys, workshops, and review of relevant documentation. 4. Documenting stakeholder input and clearly articulating how it influenced the audit plan. 5. Regularly reviewing and updating the audit plan based on ongoing stakeholder feedback and changes in the organizational environment. This iterative process ensures that internal audit remains agile, relevant, and effective in supporting the organization's objectives. Question 7. The evaluation methodology shows that a new patient portal is being implemented across multiple hospital departments. The internal audit team is tasked with assessing the risks and controls associated with this initiative. Which of the following audit approaches would best ensure comprehensive coverage of the portal's impact, considering its technological, regulatory, financial, and operational dimensions? Option A. An audit focused exclusively on the technical infrastructure and cybersecurity measures of the patient portal, assuming that robust IT controls will inherently mitigate other risks. Option B. A combined audit approach that integrates specific procedures for IT security and data integrity, compliance with patient privacy regulations, financial transaction accuracy, and operational efficiency of patient engagement and staff utilization. Option C. An audit concentrating solely on the operational efficiency of the patient portal, measuring patient satisfaction and staff workflow improvements, without delving into technical or compliance specifics. Option D. An audit prioritizing the verification of all financial transactions processed through the portal, ensuring accurate billing and payment processing, with minimal attention to other aspects. The correct answer is B. A combined audit approach that integrates specific procedures for IT security and data integrity, compliance with patient privacy regulations, financial transaction accuracy, and operational efficiency of patient engagement and staff utilization. Explanation. This scenario presents a common challenge in healthcare internal auditing: the need to balance the distinct objectives and methodologies of different audit types within a single engagement, particularly when a new initiative impacts multiple operational areas. The challenge lies in ensuring that the audit scope adequately addresses the specific risks and requirements of each audit type, without becoming overly broad or unfocused. A new patient portal implementation, for instance, inherently involves IT infrastructure, financial transactions, billing, payments, compliance with patient privacy regulations, like HIPAA in the US, and the operational efficiency of patient engagement and staff workflows. The internal auditor must possess the expertise or access to expertise to design an audit that is both comprehensive and efficient, avoiding superficial coverage of critical areas. The correct approach represents best professional practice because it acknowledges the distinct nature of each audit type and tailors the methodology accordingly. An IT audit would focus on the security, integrity, and availability of the portal's technology. A compliance audit would verify adherence to regulations like HIPAA, ensuring patient data is protected and consent mechanisms are robust. A financial audit would examine the accuracy and completeness of any financial transactions processed through the portal, such as co-payments or billing inquiries. An operational audit would assess the efficiency and effectiveness of the portal in achieving its intended goals, such as improving patient access to information or streamlining appointment scheduling. By integrating these specialized approaches, the audit provides a holistic view of the initiative's risks and controls, aligning with the Institute of Internal Auditors (IA) standards and the specific requirements for healthcare internal audits under U.S. federal regulations. An incorrect approach that focuses solely on IT controls would fail to address the significant compliance risks associated with patient data privacy and the financial implications of billing errors. This would violate the principle of comprehensive risk assessment and could lead to regulatory penalties and financial losses. Another incorrect approach that prioritizes only financial accuracy would overlook critical IT security vulnerabilities that could compromise patient data or operational inefficiencies that hinder patient adoption and satisfaction. This demonstrates a failure to consider the interconnectedness of risks and the multifaceted nature of a healthcare initiative. An approach that exclusively targets operational efficiency might miss crucial compliance gaps or IT security flaws, leaving the organization exposed to legal and reputational damage. Each of these narrow focuses represents a failure to adhere to the professional standards of internal auditing, which mandate a risk-based approach that considers all relevant control domains. The professional decision-making process for similar situations should begin with a thorough understanding of the initiative's objectives and potential risks across all relevant domains: IT, compliance, financial, operational. This involves consulting with stakeholders, reviewing relevant policies and procedures, and identifying applicable regulations. The auditor then designs an audit plan that incorporates specific audit procedures tailored to each identified risk area and audit type. This requires a strong understanding of audit methodologies and the ability to integrate findings from different audit perspectives to form a cohesive assessment. When specialized expertise is lacking, the auditor must leverage external resources or collaborate with other departments to ensure adequate coverage. Question 8. Implementation of a comprehensive internal control framework in a healthcare organization has revealed several areas of weakness. Considering the paramount importance of patient safety, regulatory compliance, and financial integrity, which of the following approaches best addresses these identified control deficiencies? Option A. Defer significant control improvements until the organization experiences a material financial loss or a major regulatory violation, as proactive investment may not yield immediate quantifiable returns. Option B. Prioritize the remediation of control weaknesses based on their potential impact on patient safety, regulatory compliance, and financial integrity, developing specific action plans for each prioritized area. Option C. Implement a standardized, universally applicable set of internal controls across all departments, regardless of specific operational risks or resource availability, to ensure consistent application. Option D. Focus on implementing cost-saving measures that indirectly strengthen controls by reducing operational complexity, even if direct control remediation is delayed. The correct answer is B. Prioritize the remediation of control weaknesses based on their potential impact on patient safety, regulatory compliance, and financial integrity, developing specific action plans for each prioritized area. Explanation. The scenario presents a common challenge in healthcare internal auditing, balancing the need for robust internal controls with the operational realities and resource constraints of a healthcare organization. The professional challenge lies in identifying the most effective and compliant approach to strengthening controls without causing undue disruption or incurring excessive costs. Careful judgment is required to align audit recommendations with regulatory expectations and organizational capacity. The correct approach represents best professional practice because it directly addresses the identified control deficiencies through a systematic, risk-based methodology. It prioritizes remediation efforts based on the potential impact on patient safety, financial integrity, and regulatory compliance, aligning with the core objectives of internal controls in healthcare. This approach is ethically sound and compliant with the principles of professional auditing, emphasizing due diligence and a commitment to improving organizational governance. It also reflects an understanding of the specific regulatory landscape governing healthcare organizations, which mandates effective controls to prevent fraud, waste, abuse, and ensure quality patient care. An incorrect approach that focuses solely on cost reduction without considering the impact on control effectiveness would be professionally unacceptable. This failure stems from a disregard for the fundamental purpose of internal controls, which is to safeguard assets, ensure accuracy of financial reporting, and promote operational efficiency and compliance. Such an approach risks violating regulatory requirements that mandate adequate controls, potentially leading to significant financial penalties, reputational damage, and compromised patient care. Another incorrect approach that proposes implementing a broad, one-size-fits-all control framework without tailoring it to the specific risks and operational context of the healthcare organization is also professionally deficient. This demonstrates a lack of understanding of risk assessment and the principle of proportionality in control design. It can lead to inefficient resource allocation, controls that are either overly burdensome or insufficient, and ultimately, a failure to achieve the desired level of assurance. This approach may also overlook specific regulatory nuances applicable to different departments or service lines within the organization. A third incorrect approach that suggests deferring control improvements due to perceived lack of immediate financial return ignores the proactive and preventative nature of effective internal controls. This is a failure to recognize that the cost of control failures, e.g., fraud, data breaches, regulatory noncompliance, often far outweighs the investment in preventative controls. Ethically, it represents a dereliction of duty to protect the organization and its stakeholders from potential harm. The professional decision-making process for similar situations should involve a thorough risk assessment, a clear understanding of the regulatory environment, and a collaborative approach with management. Auditors should identify control gaps, assess their potential impact, and recommend practical, risk-mitigating solutions. The focus should always be on enhancing the organization's ability to achieve its objectives reliably and compliantly, rather than simply meeting a checklist of requirements. This involves prioritizing recommendations based on risk, considering the cost-benefit of proposed controls, and ensuring that solutions are sustainable and integrated into the organization's operations. Question 9. Stakeholder feedback indicates concerns regarding the effectiveness of the organization's current data security protocols in protecting patient health information, particularly in light of recent regulatory updates from the U.S. Department of Health and Human Services, HHS. As a certified healthcare internal audit professional, CHIAP, which of the following approaches best aligns with your professional responsibilities and the applicable regulatory framework? Option A. Focus the audit on general operational efficiency improvements within the IT department, with a secondary consideration for data security as a minor component. Option B. Prioritize audit recommendations that offer the most immediate cost savings to the IT department, assuming that operational efficiencies will inherently improve security. Option C. Rely on the IT department's self-assessment of compliance with data security regulations, as they are the subject matter experts in system operations. Option D. Conduct an audit focused on identifying specific vulnerabilities in the data security systems and processes, assessing their compliance with HIPAA security rule requirements, and recommending corrective actions to mitigate identified risks and ensure regulatory adherence. The correct answer is D. Conduct an audit focused on identifying specific vulnerabilities in the data security systems and processes, assessing their compliance with HIPAA security rule requirements, and recommending corrective actions to mitigate identified risks and ensure regulatory adherence. Explanation. The scenario presents a common challenge in healthcare internal audit, balancing the need for robust compliance with the practical realities of operational efficiency and stakeholder expectations. The internal auditor must navigate the complex web of U.S. federal and state healthcare regulations, specifically focusing on those relevant to patient privacy and data security, while also considering the impact of audit findings on departmental operations and relationships. The challenge lies in ensuring that audit recommendations are not only compliant, but also actionable and contribute to the organization's overall risk management strategy without causing undue disruption. The correct approach represents best professional practice because it directly addresses the core mandate of internal audit as defined by professional standards, such as those from the Institute of Internal Auditors, IA, which are implicitly adopted by the CHIAP certification. This approach prioritizes identifying and assessing risks against established regulatory requirements, such as the Health Insurance Portability and Accountability Act, HIPAA, and its associated security and privacy rules. By focusing on the specific regulatory framework and its implications for patient data, the auditor ensures that findings are grounded in compliance obligations and that recommendations are designed to mitigate identified risks effectively. This aligns with the IIA's Standard 2120, Governance, Risk Management, and Control, which requires auditors to evaluate the effectiveness of risk management and control processes. An incorrect approach that focuses solely on operational efficiency without a strong grounding in regulatory compliance would be professionally unacceptable. This would fail to uphold the auditor's responsibility to identify and report on noncompliance, which could expose the organization to significant legal penalties, reputational damage, and loss of patient trust. Such an approach would violate the IIA's Code of Conduct, specifically the principle of integrity, by not acting in good faith and by not performing their duties in a manner that is in the best interest of the organization and its stakeholders. Another incorrect approach that prioritizes immediate cost savings over thorough investigation would also be professionally unacceptable. This approach risks overlooking critical compliance gaps or security vulnerabilities that, while not immediately apparent as cost drivers, could lead to far greater financial and legal repercussions down the line. This demonstrates a failure to exercise due professional care, a core tenet of the IIA's Code of Conduct, by not conducting a comprehensive and objective assessment. A third incorrect approach that involves deferring to departmental management's interpretation of regulations without independent verification would be a significant ethical and professional failure. This undermines the independence and objectivity required of internal auditors, as stipulated by the IIA's Standard 1100, independence and objectivity. Relying solely on management's views, especially on complex regulatory matters, can lead to a biased assessment and the overlooking of critical compliance issues. The professional decision-making process for similar situations should involve a systematic approach. 1. Understand the specific regulatory landscape applicable to the healthcare organization, including federal laws like HIPAA and relevant state laws. 2. Clearly define the scope of the audit based on identified risks and stakeholder concerns. 3. Gather sufficient, reliable, relevant, and useful information to support audit findings and recommendations. 4. Objectively evaluate the information against established criteria, which in this case are the regulatory requirements. 5. Develop recommendations that are practical, actionable, and directly address the identified risks and compliance gaps. 6. Communicate findings and recommendations clearly and concisely to relevant stakeholders, emphasizing the regulatory basis and potential impact of noncompliance. 7. Maintain independence and objectivity throughout the audit process, resisting undue influence from any party. Question 10. The risk matrix shows a significant control deficiency related to the procurement process that could lead to financial misstatement or fraud. The executive director, who oversees the department where the deficiency exists, has directly asked the internal auditor to exclude this specific finding from the formal audit report, citing potential disruption to ongoing negotiations with a key vendor. The auditor has confirmed the deficiency through multiple audit procedures and understands its potential impact. Option A. Discuss the finding informally with the executive director and rely on their assurance that the issue will be addressed internally without formal documentation or reporting. Option B. Include a vague mention of general procurement process improvements in the report without specifically detailing the identified control deficiency or its potential impact. Option C. Document the control deficiency, assess its potential impact on financial reporting and operations, and include it in the formal audit report with appropriate recommendations, escalating to the audit committee if necessary. Option D. Exclude the finding from the formal audit report as requested by the executive director to maintain positive working relationships and avoid disrupting vendor negotiations. The correct answer is C. Document the control deficiency, assess its potential impact on financial reporting and operations, and include it in the formal audit report with appropriate recommendations, escalating to the audit committee if necessary. Explanation. This scenario presents a professional challenge due to the inherent conflict between the internal auditor's duty to report findings objectively and the potential for negative repercussions from management, particularly when those findings relate to a senior executive. The auditor must navigate the ethical imperative of transparency and accuracy against the pressure to downplay or omit critical information that could impact relationships or career progression. This requires a strong understanding of professional auditing standards and ethical codes. The correct approach represents best professional practice because it adheres to the fundamental principles of internal auditing as outlined by the Institute of Internal Auditors, IA standards, which are implicitly the foundation for the CHIAP certification. Specifically, it upholds the standards related to objectivity, due professional care, and reporting. By documenting the control deficiency, assessing its impact, and communicating it through appropriate channels, the auditor fulfills their responsibility to provide assurance on the effectiveness of internal controls. This approach ensures that management and the audit committee are aware of the risks and can take corrective action, thereby safeguarding the organization's assets and reputation. It prioritizes the integrity of the audit process and the organization's governance framework. An incorrect approach that involves omitting the finding from the report due to pressure from the executive director represents a significant ethical failure. This violates the IIA's Code of Ethics, specifically the principles of integrity and objectivity. Objectivity requires auditors to avoid conflicts of interest and to refrain from influencing the judgments of others. Omitting a material finding compromises objectivity and can mislead stakeholders about the true state of internal controls. This also fails to meet the IIA standards related to reporting, which mandate that reports include all material findings and their implications. Another incorrect approach, which is to report the finding, but without sufficient detail or impact assessment, also falls short. While it acknowledges the issue, it fails to provide the necessary context for management to understand the severity of the risk. This demonstrates a lack of due professional care, as the auditor has not adequately investigated and communicated the potential consequences of the control weakness. The report would be incomplete and less effective in driving necessary remediation. A further incorrect approach, which is to discuss the finding informally with the executive director without documenting it or escalating it, is also professionally unacceptable. Informal discussions lack the accountability and traceability of formal reporting. It allows the issue to remain unaddressed in official records and bypasses the established governance mechanisms for oversight, such as the audit committee. This undermines the internal audit function's role in providing independent assurance. The professional decision-making process for similar situations should involve a clear understanding of the IIA standards and code of ethics. When faced with pressure or a potential conflict, the auditor should 1. Objectively assess the finding and its impact based on professional judgment and evidence. 2. Consult internal policies and procedures for reporting deficiencies. 3. If pressure persists or the situation is complex, seek guidance from the Chief Audit Executive Key or a senior audit colleague. 4. Ensure all findings are documented thoroughly and communicated through the established reporting lines, typically to management and the audit committee, regardless of the perceived sensitivity. The ultimate responsibility is to the organization and its stakeholders, not to individual executives. Question 11. Cost-benefit analysis shows that implementing a more robust, multifaceted risk assessment methodology for the healthcare organization would require additional training for the internal audit team and the procurement of specialized risk assessment software. However, operational department heads have expressed concerns that a more rigorous assessment process might uncover risks they believe are minor or could lead to increased scrutiny, potentially impacting their departmental budgets and perceived performance. Given these stakeholder perspectives and the resource implications, which approach to risk assessment best aligns with the Certified Healthcare Internal Audit Professional CHIAP standards and regulatory expectations for healthcare organizations? Option A. Prioritize risk assessment efforts based on the expressed concerns and perceived urgency of operational department heads, focusing audit resources on areas they deem most critical, and deferring a formal, in-depth risk assessment until additional resources are readily available and stakeholder buy-in is guaranteed. Option B. Conduct a risk assessment primarily driven by the internal audit team's current knowledge and experience, incorporating only the most critical regulatory requirements and patient safety concerns, while largely disregarding input from operational stakeholders to maintain audit independence and avoid potential bias. Option C. Adopt a risk assessment approach that relies solely on readily available quantitative data and financial metrics, minimizing qualitative assessments and direct engagement with operational stakeholders to streamline the process and avoid potential conflicts or perceived overreach. Option D. Implement a comprehensive risk assessment methodology that integrates qualitative and quantitative analysis, actively seeks and objectively evaluates input from all relevant stakeholders, including operational heads, and prioritizes risks based on their potential impact on patient safety, regulatory compliance, financial stability, and operational effectiveness, ensuring findings are supported by sufficient appropriate audit evidence. The correct answer is D. Implement a comprehensive risk assessment methodology that integrates qualitative and quantitative analysis, actively seeks and objectively evaluates input from all relevant stakeholders, including operational heads, and prioritizes risks based on their potential impact on patient safety, regulatory compliance, financial stability, and operational effectiveness, ensuring findings are supported by sufficient appropriate audit evidence. Explanation: the scenario presents a common challenge in healthcare internal audit, balancing the need for comprehensive risk assessment with resource constraints. Stakeholders, particularly those with direct operational responsibilities, may have a vested interest in downplaying certain risks to avoid perceived scrutiny or additional workload. The internal auditor must navigate these perspectives while adhering to professional standards and regulatory requirements for risk assessment. The correct approach emphasizes a systematic and objective methodology that integrates stakeholder input without being solely dictated by it. This aligns with the principles of professional auditing standards, which require auditors to obtain sufficient appropriate audit evidence and exercise professional skepticism. In the context of healthcare, this means considering risks that could impact patient safety, regulatory compliance, e.g., HIPAA, Stark Law, anti-kickback statute, financial integrity, and operational efficiency. A robust risk assessment methodology, such as a qualitative and quantitative approach that considers likelihood and impact, ensures that all significant risks are identified and prioritized, regardless of stakeholder comfort levels. This proactive identification and assessment are crucial for effective internal controls and compliance, directly supporting the organization's mission and safeguarding its assets and reputation. An incorrect approach would be to solely rely on the risk perceptions of operational stakeholders without independent verification or a structured assessment framework. This fails to uphold the auditor's professional responsibility to provide an objective assessment. Ethically, it could lead to a failure to identify and report significant risks, potentially exposing the organization to regulatory penalties, financial losses, or harm to patients. This approach also violates the fundamental principles of internal auditing, which mandate independence and objectivity. Another incorrect approach would be to adopt a purely quantitative risk assessment methodology without considering qualitative factors or stakeholder insights. While quantitative data is valuable, it may not capture all nuances of risk, such as reputational damage or the impact of emerging regulatory changes. Over-reliance on metrics alone can lead to a myopic view of risk, missing critical areas that require qualitative judgment and stakeholder input for a complete understanding. This can result in an incomplete risk profile and misallocation of audit resources. A third incorrect approach involves prioritizing risks based solely on the perceived urgency of operational issues, without a formal risk assessment framework. This reactive approach can lead to an audit plan that is fragmented and fails to address systemic risks. It neglects the requirement for a comprehensive and systematic evaluation of all potential risks, potentially leaving the organization vulnerable to unforeseen threats. This approach lacks the rigor and objectivity expected of internal audit and can lead to a misdirection of limited audit resources. The professional decision-making process for similar situations requires a structured approach. First, identify all relevant stakeholders and understand their perspectives on risk. Second, select and apply an appropriate risk assessment methodology that is comprehensive, objective, and aligns with professional standards and regulatory requirements. Third, gather sufficient appropriate audit evidence to support the assessment of identified risks, using both qualitative and quantitative data. Fourth, critically evaluate the evidence and stakeholder input, exercising professional skepticism. Finally, communicate the findings and recommendations clearly and objectively to management and the audit committee, ensuring that the risk assessment informs the audit plan and contributes to the organization's overall risk management framework. Question 12. Investigation of the effectiveness of a healthcare organization's patient safety monitoring activities reveals that while policies are documented, the actual implementation and adherence to these policies are not consistently verified. The internal audit department is considering how to optimize this monitoring process to ensure better compliance and patient outcomes. Which of the following approaches would best enhance the monitoring activities? Option A. Rely on incident reports as the primary source of information for identifying potential patient safety issues, and only investigate these reports when significant harm has occurred. Option B. Conduct periodic, unannounced spot checks of clinical areas to observe staff adherence to patient safety policies, without establishing specific metrics for evaluation. Option C. Implement a continuous monitoring program that utilizes key performance indicators, KPI, directly linked to patient safety protocols and regulatory requirements, with automated alerts for deviations and a defined escalation process for timely remediation. Option D. Focus on reviewing the completeness and accuracy of patient safety policy documentation during the next scheduled internal audit cycle. The correct answer is C. Implement a continuous monitoring program that utilizes key performance indicators, KPI, directly linked to patient safety protocols and regulatory requirements, with automated alerts for deviations and a defined escalation process for timely remediation. Explanation. This scenario presents a common challenge in healthcare internal audit, ensuring that monitoring activities effectively identify and address risks related to patient care and regulatory compliance. The core difficulty lies in balancing the need for comprehensive oversight with the practical constraints of resources and the dynamic nature of healthcare operations. A robust monitoring program must be proactive, not just reactive, and its findings must be communicated clearly and acted upon promptly to prevent potential harm to patients or breaches of regulatory requirements. The correct approach represents best professional practice because it emphasizes a systematic and integrated process for monitoring. It involves establishing clear metrics aligned with organizational objectives and regulatory mandates, regularly collecting and analyzing data against these metrics, and ensuring that deviations trigger a defined escalation and remediation process. This aligns with the principles of effective internal control and risk management, which are fundamental to healthcare operations and are implicitly or explicitly required by healthcare regulations designed to ensure quality and safety. The focus on continuous improvement and feedback loops ensures that the monitoring system itself evolves to address emerging risks. An incorrect approach that relies solely on ad hoc reviews fails to establish a consistent and objective basis for monitoring. This can lead to missed risks, inconsistent application of standards, and a lack of accountability. It violates the principle of systematic oversight and can be seen as a failure to implement adequate internal controls, potentially contravening regulatory expectations for risk management. Another incorrect approach that focuses only on documented policies without verifying actual practice overlooks the critical gap between policy and execution. Healthcare regulations often require adherence to specific operational standards, not just the existence of written policies. This approach fails to provide assurance that controls are operating effectively in practice, leaving the organization vulnerable to compliance failures and patient safety issues. A third incorrect approach that delays reporting findings until a major audit cycle misses the urgency often required in healthcare. Timely identification and communication of risks are crucial for prompt corrective action, especially when patient safety or regulatory compliance is at stake. This delay can exacerbate problems and lead to more significant consequences, representing a failure in effective communication and risk mitigation. Professionals should approach monitoring activities by first understanding the key risks and regulatory requirements relevant to the area under review. They should then design monitoring procedures that are objective, systematic, and capable of providing timely feedback. This involves defining clear performance indicators, establishing data collection and analysis methods, and creating a clear reporting and escalation pathway for identified issues. The decision-making process should prioritize the potential impact of identified risks on patient safety and regulatory compliance, ensuring that findings are communicated to the appropriate levels of management for timely and effective remediation. Question 13. What factors determine the most appropriate audit objectives and scope for a healthcare organization's internal audit plan, considering the perspective of key stakeholders and the organization's strategic direction? Option A. The personal interests and immediate priorities of the most senior executive in the organization. Option B. The total number of audit hours available for the upcoming fiscal year. Option C. The historical frequency of audit findings in specific departments over the past 5 years. Option D. The organization's strategic objectives, current risk assessment, and the expressed concerns of key stakeholders. The correct answer is D. The organization's strategic objectives, current risk assessment, and the expressed concerns of key stakeholders. Explanation. This scenario is professionally challenging because internal audit objectives and scope must be carefully balanced to meet diverse stakeholder needs while remaining aligned with the healthcare organization's strategic goals and regulatory compliance requirements. Overly narrow objectives risk missing critical risks, while overly broad objectives can lead to inefficient resource allocation and diluted impact. The internal auditor must exercise sound professional judgment to identify the most impactful areas for review. The correct approach represents best professional practice because it prioritizes understanding the organization's strategic objectives, current risk landscape, and the specific concerns of key stakeholders. This ensures that audit efforts are focused on areas that provide the greatest value, address the most significant risks, and support the organization's mission. For a certified healthcare internal audit professional CHIAP, this aligns with professional standards that emphasize risk-based auditing and stakeholder engagement. Specifically, it supports the principles of identifying and assessing risks relevant to healthcare operations, patient safety, and regulatory compliance, as mandated by relevant U.S. healthcare regulations and professional auditing standards. An incorrect approach that solely focuses on historical audit findings without considering current strategic shifts or emerging risks fails to be forward-looking and may miss new vulnerabilities. This can lead to a lack of assurance on critical current operations and a failure to meet the evolving needs of the organization and its stakeholders, potentially violating professional duties of due care. Another incorrect approach that prioritizes the personal preferences of a single influential stakeholder without broader consultation or risk assessment risks creating a biased audit plan that neglects other critical areas or regulatory mandates. This can lead to a failure to provide comprehensive assurance and may expose the organization to unaddressed risks, potentially violating ethical obligations to serve the organization's best interests. An approach that solely considers the availability of audit resources without a corresponding assessment of organizational risks and stakeholder priorities is inefficient and ineffective. While resource constraints are a practical consideration, they should not be the primary determinant of audit scope. Rather, they should inform the prioritization and phasing of audits once objectives and scope are established based on risk and stakeholder needs. This can lead to a failure to address material risks, which is a breach of professional responsibility. The professional decision-making process for similar situations involves a systematic approach. 1. Understand the organization's mission, vision, and strategic objectives. 2. Identify and assess the key risks facing the organization, including operational, financial, compliance, and strategic risks. 3. Engage with key stakeholders, e.g., board of directors, senior management, compliance officers, to understand their concerns and priorities. 4. Review prior audit reports and management responses to identify recurring issues or areas requiring follow-up. 5. Consider the regulatory environment and compliance requirements relevant to the healthcare sector. 6. Synthesize this information to develop audit objectives and scope that are risk-based, aligned with strategic goals, and responsive to stakeholder needs. 7. Document the rationale for the chosen objectives and scope. Question 14. When evaluating a patient safety initiative audit, an internal auditor discovers a systemic issue in medication administration protocols that has led to several near misses, though no direct patient harm has yet been documented. The department manager, who is responsible for the initiative, expresses concern that reporting these findings will negatively impact their performance review and the department's budget for the upcoming year, and subtly suggests the auditor focus on less critical aspects of the audit. What is the most appropriate course of action for the internal auditor? Option A. Immediately report the near misses to external regulatory bodies without first discussing the findings or potential corrective actions with the department manager or senior management. Option B. Include the near misses in the audit report, but minimize their significance and impact to mitigate the department manager's concerns and avoid potential conflict. Option C. Document the findings thoroughly, report them to the appropriate senior management and the audit committee, and follow up to ensure corrective actions are implemented, while maintaining professional objectivity and integrity. Option D. Agree with the department manager to focus on other audit areas and omit the medication administration findings from the current report to avoid jeopardizing departmental relationships and resources. The correct answer is C. Document the findings thoroughly, report them to the appropriate senior management and the audit committee, and follow up to ensure corrective actions are implemented, while maintaining professional objectivity and integrity. Explanation. This scenario presents a professional challenge due to the inherent conflict between the auditor's duty to report findings objectively and the potential for negative repercussions for the department being audited, particularly when those findings relate to patient safety. The auditor must navigate this delicate balance while adhering strictly to professional auditing standards and healthcare regulations. Careful judgment is required to ensure that the audit process remains independent, thorough, and that findings are communicated appropriately without compromising patient care or creating undue alarm. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the CHIAP Code of Ethics and relevant U.S. healthcare regulations, such as those enforced by the Centers for Medicare and Medicaid Services, CMS, and the Health Insurance Portability and Accountability Act, HIPAA. By escalating the findings through established channels, the auditor ensures that the identified risks to patient safety are brought to the attention of those with the authority and responsibility to implement corrective actions. This aligns with the internal auditor's role in promoting organizational effectiveness and compliance, particularly concerning critical areas like patient care. The process involves documenting the findings meticulously, communicating them to the appropriate management level, and following up to ensure resolution, thereby upholding the principles of due professional care and integrity. An incorrect approach that involves withholding or downplaying the findings would be a significant ethical and regulatory failure. This would violate the auditor's duty of objectivity and integrity, potentially leading to continued patient harm and exposing the organization to regulatory penalties for non-compliance with patient safety standards. Failing to report critical patient safety issues also undermines the purpose of internal audit, which is to provide assurance and drive improvement. Another incorrect approach, such as immediately reporting the findings to external regulatory bodies without first attempting to resolve them internally through established management channels, could be premature and bypass the organization's own corrective action processes. While external reporting is sometimes necessary, it should typically follow a failure of internal resolution or in cases of imminent, severe harm that the organization is unwilling or unable to address. This could also damage internal relationships and the audit department's credibility. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly investigate and document all findings related to patient safety. Second, assess the severity and potential impact of the identified risks. Third, consult the CHIAP Code of Ethics and relevant U.S. healthcare regulations to understand reporting obligations and best practices. Fourth, communicate findings and recommendations clearly and objectively to the appropriate level of management, providing sufficient time for corrective action. Fifth, if corrective actions are not taken or are inadequate, follow established escalation procedures within the organization, which may ultimately include reporting to external regulatory bodies if patient safety remains compromised. Question 15. System analysis indicates that a healthcare organization's internal audit team is reviewing adherence to a critical clinical pathway for managing a specific chronic disease. The audit objective is to assess compliance with established clinical guidelines and protocols. The team has access to patient electronic health records, organizational policies, and the relevant clinical guidelines. Which of the following approaches would best fulfill the audit objective while adhering to professional auditing standards and regulatory expectations for healthcare quality? Option A. Focus the audit solely on identifying any instance where a clinician's actions do not precisely match the step-by-step instructions in the clinical guideline, regardless of the clinical context or patient response. Option B. Examine the organization's policies for the existence of clinical guidelines and protocols, and then verify that all clinicians have signed attestations confirming their awareness of these guidelines. Option C. Review a sample of patient records to identify instances where the documented care deviates from the established clinical pathway, and for each deviation, investigate the clinical rationale and documentation supporting the decision, assessing the impact on patient outcomes. Option D. Conduct a review of patient outcome data for the chronic disease population and compare it to benchmarks, assuming that positive outcomes indicate compliance with clinical guidelines. Correct answer is C. Review a sample of patient records to identify instances where the documented care deviates from the established clinical pathway, and for each deviation, investigate the clinical rationale and documentation supporting the decision, assessing the impact on patient outcomes. Explanation. This scenario presents a professional challenge due to the inherent tension between established clinical best practices, codified in guidelines and protocols, and the potential for individual clinician variation or emergent patient needs. Internal auditors are tasked with assessing compliance, which requires a nuanced understanding that strict adherence may not always be feasible or optimal, yet significant deviations without proper justification can indicate systemic risks. The challenge lies in distinguishing between acceptable clinical judgment and noncompliance that compromises patient safety or regulatory adherence. The correct approach represents best professional practice because it prioritizes a comprehensive review that considers both the documented guidelines and the clinical context. This involves not only verifying adherence to established protocols, but also evaluating the rationale and documentation for any deviations. This aligns with the core principles of healthcare internal auditing, which aim to provide assurance on the effectiveness of controls and the achievement of organizational objectives, including patient care quality and regulatory compliance. Specifically, it reflects the need to assess whether deviations are documented, justified, and do not negatively impact patient outcomes, thereby upholding ethical obligations and regulatory requirements for quality patient care. An incorrect approach that focuses solely on the absence of documented deviations, without considering the clinical rationale or patient outcomes, fails to provide a complete picture of compliance. This can lead to an inaccurate assessment of risk and potentially overlook areas where clinical judgment was appropriately exercised, or, conversely, where deviations were made without adequate justification, posing a risk to patient safety and potentially violating standards of care. Another incorrect approach that dismisses any deviation from guidelines as noncompliance, regardless of clinical justification or positive patient outcomes, is overly rigid and impractical. Healthcare is a dynamic field, and clinical guidelines are intended to inform, not dictate, every decision. Such an approach ignores the importance of clinical expertise and the need for individualized patient care, potentially leading to a demoralized workforce and an audit that is perceived as unhelpful or even detrimental. This can indirectly lead to noncompliance with the spirit of regulations that emphasize quality and effectiveness of care. A further incorrect approach that relies solely on patient outcome data to infer compliance with clinical guidelines, without examining the process or adherence to protocols, is also flawed. While positive outcomes are desirable, they do not automatically confirm that the correct processes were followed. Positive outcome could be coincidental or achieved through methods that bypassed established, evidence-based protocols, which could represent a missed opportunity for learning and improvement, or even a hidden risk if the deviation becomes widespread. This approach fails to provide assurance on the reliability and consistency of care delivery. The professional reasoning process for similar situations should involve a risk-based audit approach. Auditors should first understand the relevant clinical guidelines and protocols, their regulatory basis, and their intended purpose. They should then assess the organization's policies and procedures for ensuring adherence and managing deviations. The audit should involve a combination of data analysis, interviews with clinical staff, and review of patient records. When deviations are identified, the auditor must investigate the context, the justification provided, and the impact on patient care and outcomes. This systematic approach ensures that the audit is thorough, fair, and provides actionable insights for improving compliance and patient care. Question 16. The assessment process reveals significant overpayments to a healthcare provider due to a systemic billing error that has been ongoing for an extended period. The internal audit team has identified the root cause and quantified the overpayments. Considering the Office of Inspector General (OIG) guidelines for healthcare providers, which of the following actions best aligns with regulatory expectations and best professional practice for internal audit? Option A. Immediately initiate a comprehensive internal remediation plan to correct the billing error and recover overpayments, without direct engagement with the OIG, assuming internal correction is sufficient. Option B. Cease all billing activities related to the identified error and await further direction from regulatory bodies before implementing any corrective actions. Option C. Proactively engage with the Office of Inspector General (OIG) to discuss the findings, self-disclose the overpayments, and collaborate on a corrective action plan that incorporates OIG recommendations for remediation and future prevention. Option D. Conduct a thorough internal investigation to fully document all aspects of the error and its impact before considering any external reporting or corrective actions. The correct answer is A. Immediately initiate a comprehensive internal remediation plan to correct the billing error and recover overpayments, without direct engagement with the OIG, assuming internal correction is sufficient. Explanation. This scenario is professionally challenging because it requires the internal auditor to balance the immediate need for corrective action with the OIG's specific guidance on reporting and remediation. The auditor must understand the nuances of OIG guidelines, particularly concerning self-disclosure and the potential for program exclusions, while also ensuring the healthcare organization addresses the identified compliance issues effectively. Careful judgment is required to determine the appropriate level of engagement with the OIG and to implement remediation that aligns with regulatory expectations. The correct approach represents best professional practice because it directly addresses the OIG's emphasis on proactive compliance and self-reporting. By initiating a dialogue with the OIG and developing a corrective action plan that incorporates OIG recommendations, the auditor is demonstrating a commitment to resolving the identified issues in a manner that mitigates further risk to the organization and aligns with federal healthcare program integrity objectives. This proactive stance is crucial for maintaining a positive relationship with regulatory bodies and for demonstrating a robust compliance program. An incorrect approach that involves solely focusing on internal remediation without considering OIG reporting requirements fails to acknowledge the potential severity of the identified issues and the OIG's mandate to protect federal healthcare programs. This could lead to a failure to meet self-disclosure obligations, potentially resulting in increased penalties or sanctions. Another incorrect approach that involves immediately ceasing all related activities without a structured remediation plan overlooks the OIG's expectation of corrective action and may not adequately address the root cause of the noncompliance, leaving the organization vulnerable to future issues. An approach that involves delaying reporting until a complete internal investigation is finalized without any interim communication can be perceived as a lack of transparency and may not satisfy the timeliness requirements often implied in OIG guidance for self-disclosure. Professionals should employ a decision-making framework that begins with a thorough understanding of the OIG's specific guidance relevant to the identified noncompliance. This involves assessing the materiality of the issue and its potential impact on federal healthcare programs. The next step is to determine if the situation triggers self-disclosure requirements. If so, the auditor should consult with legal counsel and compliance leadership to formulate a reporting strategy that adheres to OIG timelines and content requirements. Simultaneously, the auditor should collaborate with management to develop and implement a comprehensive corrective action plan that addresses the root causes of the noncompliance and includes robust monitoring and auditing mechanisms to prevent recurrence. Question 17. The efficiency study reveals that the patient registration process is experiencing significant delays, leading to patient dissatisfaction. To expedite this process, the IT department proposes implementing a new system that allows for broader access to patient demographic and insurance information across multiple departments. As an internal auditor, which of the following actions best addresses the potential regulatory implications of this proposed system change, considering the U.S. healthcare regulatory framework? Option A. Focus the audit on the financial efficiency gains of the new system, deferring any detailed review of patient data access to a later, separate audit if specific concerns arise. Option B. Conduct a thorough review of the proposed system's access controls and data handling procedures to ensure compliance with HIPAA privacy and security rules, focusing on the principle of minimum necessary access and permissible disclosures of protected health information. 5. Option C. Advise the organization to adopt general data privacy best practices for managing patient information, as these are typically sufficient for most industries, including healthcare. Option D. Recommend the immediate implementation of the new system to improve patient experience, assuming that any necessary privacy considerations will be addressed by the IT department's standard security protocols. The correct answer is B. Conduct a thorough review of the proposed system's access controls and data handling procedures to ensure compliance with HIPAA privacy and security rules, focusing on the principle of minimum necessary access and permissible disclosures of protected health information. 5. Explanation. The efficiency study reveals a potential gap in how patient health information is accessed and shared within a healthcare organization. This scenario is professionally challenging because internal auditors must balance the need for operational efficiency with the stringent requirements of patient privacy and data security mandated by U.S. federal healthcare regulations. Misinterpreting or overlooking these regulations can lead to significant legal penalties, reputational damage, and erosion of patient trust. The correct approach represents best professional practice because it prioritizes a thorough understanding and application of the Health Insurance Portability and Accountability Act, HIPAA, and the Health Information Technology for Economic and Clinical Health HITECH Act. These laws establish the standards for protecting sensitive patient health information. By focusing on the specific requirements for permissible disclosures, minimum necessary use, and appropriate safeguards, the internal audit team ensures compliance and protects patient rights. This aligns with the ethical duty of internal auditors to uphold professional standards and contribute to organizational integrity. An incorrect approach that focuses solely on streamlining workflows without considering the regulatory implications fails to acknowledge the legal framework governing protected health information. 5. This oversight constitutes a significant regulatory failure, as it risks unauthorized access, use, or disclosure of PHI, violating HIPAA and HITECH. Such an approach also demonstrates a lack of ethical consideration for patient privacy. Another incorrect approach that assumes existing IT security measures are sufficient without a specific audit against HIPAA security rule standards is also professionally unacceptable. This is a regulatory failure because it bypasses the requirement for a systematic assessment of technical, physical, and administrative safeguards. It is ethically problematic as it neglects the due diligence required to protect sensitive data. A third incorrect approach that relies on general best practices for data management without referencing specific healthcare regulations is inadequate. While general best practices are valuable, they do not substitute for the detailed requirements of HIPAA and HITECH. This is a regulatory failure because it fails to address the unique and specific mandates for healthcare data protection, potentially leaving the organization vulnerable to noncompliance. Ethically, it represents a failure to apply the specialized knowledge expected of a healthcare internal auditor. The professional decision-making process for similar situations involves a systematic approach. First, identify the relevant regulatory landscape, HIPAA, HITECH, ACA in the U.S. context. Second, understand the specific operational process being reviewed and how it interacts with protected health information. Third, assess the process against the explicit requirements of applicable regulations, focusing on areas like permitted uses and disclosures, security safeguards, and breach notification protocols. Fourth, document findings clearly, highlighting any deviations from regulatory requirements and recommending corrective actions that ensure both efficiency and compliance. Question 18. The risk matrix shows a significant increase in the potential for fraud, waste, and abuse within the outpatient billing department. The internal audit department has limited personnel and a tight timeline for completing its annual audit plan. Which of the following approaches best addresses this situation while adhering to regulatory requirements for fraud, waste, and abuse oversight? Option A. Postpone the audit of the outpatient billing department until additional resources become available, prioritizing other areas with lower identified risk. Option B. Perform a high-level, cursory review of all processes within the outpatient billing department to provide a broad overview, acknowledging the resource limitations. Option C. Conduct a targeted audit focusing on the highest-risk subprocesses within outpatient billing, such as unbundling of services and upcoding, based on preliminary data analysis and known FWA schemes. Option D. Engage an external firm to conduct the entire audit of the outpatient billing department, without significant internal oversight to expedite the process. The correct answer is C. Conduct a targeted audit focusing on the highest-risk subprocesses within outpatient billing, such as unbundling of services and upcoding, based on preliminary data analysis and known FWA schemes. Explanation: this scenario presents a common challenge in healthcare internal audit, balancing the need for robust fraud, waste, and abuse FWA detection with the practical realities of resource constraints and the potential for disruption to patient care. The Internal Audit Department is tasked with investigating a high-risk area identified by the risk matrix, but faces limitations in personnel and time. The core professional challenge lies in determining the most effective and compliant approach to address the identified risk, without compromising the organization's ability to provide services or violating regulatory mandates. The correct approach represents best professional practice because it prioritizes a risk-based methodology, aligning with the principles of effective internal auditing and regulatory expectations for FWA prevention and detection. By focusing on a targeted audit of the highest-risk subprocesses within the identified area, the internal audit team can maximize the impact of their limited resources. This approach ensures that the audit effort is directed where it is most likely to uncover FWA, thereby fulfilling the department's mandate to protect the organization's assets and ensure compliance with regulations such as the False Claims Act and the Anti-Kickback Statute. This also demonstrates due diligence in addressing identified risks proactively. An incorrect approach that involves delaying the audit due to resource constraints is professionally unacceptable. This failure to act on a known high-risk area, as indicated by the risk matrix, constitutes a dereliction of duty and a potential violation of the internal auditor's professional responsibilities. It exposes the organization to increased risk of FWA and subsequent penalties. Furthermore, such a delay could be interpreted as a lack of commitment to compliance, potentially leading to regulatory scrutiny and reputational damage. Another incorrect approach, such as attempting a superficial review of the entire high-risk area without sufficient depth, is also professionally unsound. While it might appear to address the risk, a lack of thoroughness means that significant FWA could be missed, rendering the audit ineffective. This superficiality fails to meet the standards of professional auditing practice and does not adequately mitigate the identified risks. It also fails to provide assurance to management and the audit committee that the FWA risks are being appropriately managed. Finally, an incorrect approach that involves outsourcing the entire audit without adequate internal oversight or understanding of the specific FWA risks is problematic. While outsourcing can be a valuable tool, abdicating all responsibility without proper engagement and review can lead to a loss of institutional knowledge and a disconnect from the organization's unique FWA landscape. This can result in an audit that is not tailored to the specific risks and may not identify all relevant FWA issues, potentially leading to compliance gaps. The professional decision-making process for similar situations should involve a thorough assessment of the identified risk, an honest evaluation of available resources, and a strategic prioritization of audit activities. When resources are constrained, the focus must remain on the highest-risk areas and the most impactful audit procedures. This requires collaboration with management to understand operational pressures, but ultimately, the internal audit function must maintain its independence and professional skepticism to ensure that FWA risks are adequately addressed in accordance with regulatory requirements and professional standards. Question 19. The audit findings indicate potential overpayments to a large network of healthcare providers based on preliminary review of claims data. As a certified healthcare internal audit professional CHIAP, operating under U.S. regulations, which analytical procedure would best balance the need for comprehensive risk assessment with strict adherence to patient privacy and data security mandates? Option A. Utilize data analytics to compare aggregated payment trends across provider categories against industry benchmarks, focusing on de-identified or aggregated financial data. Option B. Conduct a detailed analysis of individual patient claims, including all associated protected health information, FI, to identify specific billing discrepancies. Option C. Request and review paper-based patient medical records for a sample of claims to manually verify billing accuracy. Option D. Perform a statistical analysis on a small, randomly selected subset of claims, without considering the potential for PHI exposure or the need for de-identification. The correct answer is B. Conduct a detailed analysis of individual patient claims, including all associated protected health information, FI, to identify specific billing discrepancies. Explanation. This scenario presents a challenge because internal auditors must balance the need for efficient data analysis with the imperative to comply with healthcare regulations, specifically those pertaining to patient privacy and data integrity. The auditor must select analytical procedures that are both effective in identifying potential risks and compliant with the Health Insurance Portability and Accountability Act, HIPAA, in the United States, which governs the use and disclosure of protected health information, FI. The correct approach involves utilizing analytical procedures that leverage aggregated or de-identified data where possible, or employing robust data security and access controls when working with identifiable PHI. This aligns with HIPAA privacy rule, which permits the use of PHI for healthcare operations, including auditing, provided appropriate safeguards are in place. Furthermore, it adheres to the principles of data minimization and purpose limitation, ensuring that only necessary data is accessed and analyzed for the audit's objectives. This method upholds the integrity of the audit process while respecting patient confidentiality and regulatory mandates. An incorrect approach would be to directly access and analyze raw patient billing data without first de-identifying it, or ensuring that the audit team has the necessary authorizations and security clearances under HIPAA. This could lead to a breach of PHI, violating HIPAA security rule and privacy rule, and potentially resulting in significant penalties. Another incorrect approach would be to rely solely on anecdotal evidence or manual sampling, without employing systematic analytical procedures. This fails to provide a comprehensive and objective assessment of the financial operations, potentially missing systemic issues, and not meeting the professional standards for internal auditing as outlined by the Institute of Internal Auditors, IA, which are implicitly expected within the CHIAP framework. A third incorrect approach would be to use analytical tools that are not validated or are known to have data security vulnerabilities, thereby risking the compromise of sensitive financial and patient data, which is a direct contravention of both regulatory requirements and professional ethical obligations. Professionals should approach such situations by first understanding the specific regulatory landscape, HIPAA in this case, and the audit objectives. They should then identify analytical techniques that can achieve the audit objectives while minimizing the risk of regulatory noncompliance. This involves consulting with legal counsel or compliance officers if there is any ambiguity regarding data handling and privacy. The decision-making process should prioritize data security, patient privacy, and regulatory adherence, followed by the effectiveness and efficiency of the analytical procedures. Question 20. Risk assessment procedures indicate a potential for unauthorized access to sensitive patient health information stored within the hospital's electronic health record system due to a recent increase in remote work arrangements. The internal audit team is tasked with evaluating the effectiveness of controls designed to protect this data. Considering the COSO framework overview, which of the following approaches would best align with the initial stages of assessing this risk and developing appropriate assurance? Option A. Analyzing the communication channels and training materials provided to staff regarding data security policies and procedures for remote work. Option B. Reviewing existing access logs and security protocols for the EHR system to identify any immediate anomalies or policy violations. Option C. Evaluating the design and implementation of controls related to remote access, multi-factor authentication, and data encryption, ensuring they are directly linked to the identified risk of unauthorized access. Option D. Assessing the effectiveness of the hospital's incident response plan and post-breach notification procedures to ensure timely and appropriate action if a breach occurs. The correct answer is B. reviewing existing access logs and security protocols for the EHR system to identify any immediate anomalies or policy violations. Explanation: this scenario is professionally challenging because it requires the internal auditor to navigate the complexities of the COSO framework in a practical healthcare setting, specifically concerning the identification and assessment of risks related to patient data privacy. The auditor must not only understand the theoretical components of COSO, but also apply them to a real-world situation where regulatory compliance, e.g., HIPAA in the U.S. context, as implied by the CHIAP exam's likely jurisdiction, is paramount. The interconnectedness of the COSO components means that a weakness in one area can significantly impact others, demanding a holistic and integrated approach. The correct approach represents best professional practice because it directly aligns with the principles of the COSO internal control integrated framework, specifically focusing on the risk assessment component. By identifying relevant internal and external risks, assessing their likelihood and impact, and considering the potential for fraud, the auditor is performing a fundamental step in establishing effective internal controls. This proactive identification and evaluation of risks are crucial for preventing or detecting control deficiencies before they lead to breaches or non-compliance. This aligns with the internal auditor's role in providing assurance over the effectiveness of risk management and control processes, as expected under professional auditing standards. An incorrect approach that focuses solely on the control activities component without a thorough risk assessment would be professionally unacceptable. This is because control activities are designed to mitigate identified risks. Implementing controls without understanding the underlying risks is inefficient and ineffective, potentially leading to controls that are either insufficient to address significant risks or unnecessarily burdensome for minor ones. This failure to adequately assess risks violates the foundational principles of the COSO framework and the internal auditor's responsibility to provide assurance on the design and operating effectiveness of controls in relation to identified risks. Another incorrect approach that prioritizes monitoring activities over initial risk assessment would also be a regulatory and ethical failure. Monitoring is designed to assess the ongoing effectiveness of internal controls over time. If the initial risk assessment and control design are flawed, monitoring activities will only detect problems after they have occurred, potentially leading to significant harm, data breaches, or regulatory penalties. This reactive approach fails to meet the proactive assurance expectations of internal audit and the COSO framework. A further incorrect approach that focuses exclusively on information and communication without a robust risk assessment would be similarly flawed. While effective communication of risks and controls is vital, it cannot compensate for a lack of understanding of what those risks are. Without a proper risk assessment, the information being communicated may be incomplete, inaccurate, or irrelevant, rendering the communication ineffective in achieving its intended purpose of supporting risk management and control. The professional reasoning process for similar situations should involve a systematic application of the COSO framework. First, understand the entity's objectives. Second, identify and assess relevant risks that could prevent the achievement of those objectives, considering both internal and external factors. Third, design and implement control activities to mitigate those identified risks. Fourth, ensure that relevant information is identified, captured, and communicated effectively. Finally, establish monitoring activities to assess the ongoing effectiveness of the internal control system. This iterative and integrated approach ensures that controls are risk-driven and aligned with organizational objectives.